My name is Segula. I'm a pediatric oncology nurse. I am from Malawi, Africa. I'm working under Baylor College of Medicine, Children's Foundation. I was recommended for the Merck Foundation Cancer Training Program by the First Lady's Office of my country. In Malawi, we face a lot of challenges pertaining to cancer care. One of it is increased disease burden of cancer. This is seen amongst the patients that report to the hospital. Most of the patients, because of low literacy levels, they spend much of their time and resources going to the traditional healers, which are not conversant with cancer signs and symptoms. And they waste much of their time in those places. The time that they report for medical attention, always it's in the late stages, and this affects their survival rate. The second challenge that we face in Malawi as a country is lack of resources. Malawi is one of the underdeveloped countries, and we only have one national cancer center, which is located in the central region. And this cancer center is not fully functional in the sense that some of the facilities in the cancer center are not in operation. For instance, we were meant to have a radiation plant, but right now it's not yet built and established, and we do not know when it's going to be established and running. So this affects cancer management in the sense that most of the patients, they do not respond to chemotherapy alone or surgery alone, and only those that can afford, they go to other countries like Zambia and Tanzania for radiation. And some even travel as far as India to get treatment for their cancer. So this is a great challenge as a country, because if we had radiation therapy in place, I'm sure that the cancer survival rate in our country would have been so much improved, and would see great milestones achieved as far as cancer management is concerned. The third challenge that we face as a country in Malawi is lack of civic education to the rural areas, even in the cities. Most of the people do not know what cancer is, and they are not aware when the cancer starts. They do not know the symptoms pertaining to cancer. So they mistake the cancer for other diseases. Not only the common people, but even most of the healthcare workers in the primary sector, in the primary health sector, they are not well conversant of the cancer signs and symptoms. This makes them to misdiagnose the cancers and give a wrong treatment. In the process, the patients are delayed for early diagnosis of cancer and management. And when they are referred to the tertiary care, it's already in advanced stages, and this affects cancer management and contributes to the high death rate amongst cancer patients. In Malawi, we have few nurse specialists in the oncology section. What happens is, we as nurses, we undergo general nursing training, and there is no specialized cancer program for the nurses. So the nurses that work in the pediatric and adult oncology section are only general nurses. Because of the high disease burden, we receive and attend to a lot of patients. Like in my case, in our pediatric oncology setting, you find that there are only 5 nurses on the day shift attending to about 30 patients, some of which are very critically ill, and to give total and comprehensive care to all these patients demands a lot from the nurses. On daily basis, as nurses, we are responsible for total and comprehensive care of our patients. First thing every morning when we come for shifts, we have to conduct assessments in nursing rounds, and when we do that, we identify the nursing needs of our patients, and we have to provide care according to individual needs. it's more of case-based care that we give as nurses. Apart from carrying out our nursing responsibilities on a daily basis, we have to treat the patients as individuals, of which most of the patients have different needs according to where they are coming from. This oncology nursing program is very important for me as a nurse because it has empowered me with the right skills and the right attitude and expertise that I'm going to take home, and I'm going to improve the care that I'll give to my cancer patients. I've learned that cancer patients are just like any other patient, and they have to be treated holistically. That means they have to be taken care of in all dimensions: the spiritual aspect, the physical aspect, the emotional aspect, even their families, because they are the ones that are responsible for the patients throughout. They also have needs that they need to be taken care of. So as a nurse, I've been empowered and my capacity has been built to be able to take care of my patients, not like I used to do, but now in a more improved way that is going to make a long-lasting effect on them and their families. When I enrolled in this program, my greatest expectation was to learn how cancer is managed on this other side of the world. Because of resource limitation in our country, we do not have access to some of the improved and advanced methodologies of treatment. So coming here has been a great opportunity for me to be exposed to a lot of treatment modalities like radiotherapy, bone marrow transplantation, chemotherapy, and many other treatment modalities. So far, so good. My expectations have been met, even more than that, because despite that I have gained clinical knowledge and expertise, I've also been exposed to Indian culture, and that has improved my interpersonal relationships, and I've been able to build connections and networks that will last forever. Even when I go back home, I'll be able to network with my colleagues on this other side of the world and continue to share experiences that will help to benefit my patients in Malawi. My advice to the new aspirants of this program, I would really encourage you to undertake this program. It is a very comprehensive program that will expose you to a lot of clinical skills and knowledge that will help to build capacity and improve our clinical skills that will enhance the care that you as a nurse or doctor or in any other field to perfect your skills, attitude and knowledge to take care of the patients and to improve their quality of life. My recommendation for the program, I would first say the program is well structured, but maybe because 3 months is not a lot of time that one can get to grasp all the theoretical principles as well as the practical principles of cancer care. So I would recommend a bit of extension, maybe to 6 months or even 1 year, because that will really give one time to learn the right principles, to acquire the right knowledge and to perfect the clinical skills that will help in building capacity in cancer management. In Malawi, we do not have specialized programs like the Merck Foundation cancer training program. We only receive general training from college, and afterwards we only have in-service trainings which happen as continuing professional development lessons that help us to build capacity and to extend our knowledge and expertise in as far as care is related. So this program is very important, and I would recommend similar programs to be instituted or established in many countries in Africa, including Malawi, where we get nurses to be trained in special courses that will help them to improve the care that they give to their patients. I would like to extend my warm gratitude to the First Lady of Malawi, Madam Monica Chakwera, for recommending me for the program. I would also like to thank the CEO of Merck Foundation, Dr. Rasha, Kelej, and also the Chancellor of Krishna Institute of Medical Sciences, Dr. Suresh Bosley, for the opportunity that was granted me to pursue the fellowship program in nursing oncology at this institution.